Hello, everyone. Good morning, and thank you all for joining us today to discuss the United States' foreign policy implications of overturning Roe v. Wade. My name is Samira Damavandi. I am a global policy advocate at the International Center for Research on Women, and I use she, her pronouns. The International Center for Research on Women is pleased to launch our policy brief on this issue today, and you'll be able to find it at our website, ICRW.org, later. We will also be sharing this out. Additionally, we will be having a Q&A at the end of this event, so if you have any questions for our panelists, please feel free to put it there. On June 24th, 2022, the United States Supreme Court ruled on the case Dobbs versus Jackson Women's Health Organization and decided that abortion is not a constitutionally protected right. This landmark decision overturned the nearly 50-year precedent created by Roe v. Wade that protected the right to abortion. The Dobbs decision gave power to individual states to implement laws restricting access to abortion. And while we know this decision has already had devastating impacts domestically, we specifically wanted to analyze what the decision means for U.S. foreign policy. Not only does this ruling enable restrictions on bodily autonomy and access to comprehensive health care, especially for people of color who can get pregnant, it may also embolden anti-abortion and anti-rights movements abroad, contribute to the global stigmatization of abortion, and cause confusion in foreign policy and international development spaces. The World Health Organization affirms that abortion is a safe and non-complex healthcare intervention, but globally 45% of abortions are unsafe, meaning they're carried out by people lacking the necessary skills or in an environment that doesn't conform to medical standards. The United States is the largest donor globally for family planning and reproductive health foreign aid, and thus we know that U.S. policies have the ability to shape or change the global landscape. While the Dobbs decision alone does not change the administration's policy on sexual and reproductive health and rights, there is concern that it could lead to a chilling effect globally. Today, we have a brilliant group of speakers here to discuss this, and we'll be able to unpack the potential global implications of the decision, and I'm looking forward to us having a vibrant discussion. I would like to welcome our distinguished speakers. We have Sarah Craven, the Director of the Washington Office of the United Nations Populations Fund, UNFPA. Prior to her work at UNFPA, Sarah held positions at the United States Department of State and on the legislative staff for U.S. Senators Tim Wirth and Spark Matsunaga. She served as policy advisor to CEDPA during the 1994 International Conference on Population and the 1995 Fourth World Conference on Women in Beijing, China. We have Dr. Jean-Claude Mulunda, the country director for Ipas, DRC, the Democratic Republic of the Congo. He is a highly experienced trainer and outspoken advocate for sexual and reproductive health and rights. He has advocated for sexual and reproductive health and rights and universal access to high quality SRH care, including legal and safe abortion, for over 12 years. Nelly Munyasia, Executive Director of the Reproductive Health Network Kenya. Reproductive Health Network Kenya is a network of trained healthcare providers who are passionate about ensuring quality, comprehensive reproductive health information and services. Nelly is a trained nurse and midwife, a health systems and policy expert, a global award-winning sexual and reproductive health provider champion, and an advocate for human rights. And last but not least, we have Jamille, Bigio, Senior Coordinator for Gender Equality and Women's Empowerment at the U.S. Agency for International Development, USAID. Prior to joining USAID, Ms. Bigio served as a Senior Fellow on Women in Foreign Policy at the Council on Foreign Relations, where she researched, lectured, and published widely on the relationship between gender equality, national security, and global prosperity. She previously served as the Director for Human Rights and Gender on the White House National Security Council, NSC staff, and as the NSC representative on the White House Council on Women and Girls. Thank you all so much for joining us this morning. So let's go straight into our first question. So Jamila, I'll turn it to you. Given the global uncertainty, can you speak to what the administration's position is on the Dobbs decision and whether there have been any changes in policy that impact foreign policy and aid?
Thank you so much. And my thanks to ICRW for hosting this conversation, and to my fellow panelists, thrilled to be in dialogue with you. And welcome this first question to help situate us and what the current context is. So first, I would highlight that the Supreme Court's decision does not change existing overseas U.S. reproductive health programming or funding. So the U.S. will continue to support global sexual reproductive health and rights programs, including through comprehensive programming on voluntary family planning, maternal health care, post-abortion care, and prevention and response to gender-based violence. There are already longstanding federal statutory restrictions related to abortion that apply to U.S. foreign assistance. And these were unaffected by the Supreme Court decision. So they continue to hold and were not changed by the recent Dobbs decision. So we, in the United States, therefore, are continuing to advance SRHR. We see it as fundamental to accelerating universal health coverage, to achieving gender equality and equity, to promoting and protecting the human rights of women, girls, and LGBTQI+ persons, particularly those who face multiple and intersecting forms of discrimination. We also recognize that to build a future with equity and equality for all depends on safeguarding our health and wellness, including protecting and advancing sexual and reproductive health and rights for all. So in terms of what the United States and the administration's position is, what our policy and our programs are around foreign policy and aid on SRHR, the United States will continue to prioritize partnering with governments, with the private sector, with international and non-governmental organizations to improve health outcomes. And we see advancing sexual and reproductive health and rights and the empowerment of women and girls as critical to achieving these outcomes, as priorities to helping women and girls achieve their full potential to drive social and economic development. So we will continue to invest in programs and policies that advance sexual and reproductive health and rights driven by this commitment and this vision. Thank you.
Thank you so much, Jamila. I think that's really helpful for our audience to hear that. So I appreciate you delving into this a bit deeper. I'm going to turn our next question over to all of you and just ask, how has the Dobbs ruling impacted the work you're doing in the countries that you're in and do work in? And what concerns has this raised, or what concerns have you heard? So first, if we could turn it over to Nelly.
Good morning, good evening from Kenya. Thank you so very much to ICRW for having me here, and more importantly, just to bring in the situation as it is back in Kenya, and I think it applies across Africa as a region. How this affects, and this is just immediate effects in terms of the work that we do. I work for a network of healthcare providers that are passionate about ensuring that women access contraceptives, access safe abortion services, and also, ensuring that the sexual minorities also have access to services. So this definitely instills fear in our healthcare providers, given that we have continued to experience a boldened opposition that is well organized, has non-restricted funding, that they are able to quickly convene, quickly, have meetings, have media conversations on the legalities around access to safe abortion services. This also immediately restricts definitely women's rights access to safe abortion services, which also includes contraceptives. And this is through instilling fear. The stigma and the fear that comes with such pronunciation is massive to the women and girls back here in Kenya. Then, the women and the healthcare providers are then left in a situation where they don't know whether to save lives or being arrested. And given that they have a responsibility as trained experts to provide services, then they are left with a tough choice of, let's provide services and probably get arrested and see what happens after that. So generally, there's nothing as preventing abortion. It's only banning safe abortion. And this then leads to women and girls accessing services from untrained healthcare experts. In Kenya, 7 women and girls die every day due to unsafe abortion. So really, it's just a matter of time, and then we should be seeing the numbers going up. Thank you, Samira.
Thank you, Nelly. Jean-Claude, I'll turn it over to you.
Thank you so much. Greetings from Kinshasa, Democratic Republic of Congo. So happy to be here and share our experience and impacts that we're seeing here on the ground. I can say that in Democratic Republic of Congo, as in many African countries, especially in the Francophone region, the law related to sexual and reproductive rights, has been for a long time restrictive and still restrictive in many countries as well. So actually we have this regional treaty known as Maputo Protocol, which allowed access to safe abortion under some circumstances and some condition. And in DRC, for example, in the way of domesticating Maputo Protocol, the Minister of Health, with partner support, have developed standard guidelines for safe abortion, which are really progressive and allowed women to have access to to safe abortion in many circumstances, which is really fine. And I think the commitment and motivation for the Minister of Health is not only to meet the promise they took to the African Union on the Maputo Protocol, but it's also to respond to the need, a growing need coming from communities, from women movement, which are fighting for the right of the woman and the right to have access to safe abortion. But it's also coming from the fact that abortion, unsafe abortion, is the second lead of maternal mortality in the country, and the DRC is one of the countries where the maternal mortality is really high. So this is like a commitment for the government to take advantage, leveraging this regional treaty to reduce maternal mortality. So many steps have been taken by the government, and actually abortion services are available in many public facilities, which is really fine. Now, all those commitment coming from the government, save women, of course, life. But what we're saying now is that with the change which is happening in the US, there's many questions now, that are raised in the country. And the first one is at the political level, because you know that US government have at some point influence on many government, in other countries, especially those who are in low-income region, like my country. So when the US have changed something, it's kind of, even if they do not say anything, people are preparing themselves to align on what they're doing. So there already some discussion about, okay, yes, of course, the abortion is at some point not considered like a need for women, but something coming from elsewhere, from US, from Europe, and something like that. If US is changing today, so what is the importance for her to domesticate Maputo Protocol, for example? Is it really important to allow access to abortion? Because if it's important, why are they changing? Because they started before us. And that's at the political level, and this can have an impact on the domestication protocol and all the consequences on women's life. So when you go at the the community level, you'll find that there's an increase on stigma, and many religious group and traditional group, anti-choice, are now trying to use this change in the US to show that abortion is not something good and women should not have access to that. So which makes how we work a bit difficult on the ground. So we're fearing about any, change that can impact all the effort that the government, the civil society organization, and all the partners work together to arrive there. So we are feeling about that. But the last thing I wanted to mention is the increase of stigma in the community, but also within the health system. For example, for the providers that are providing abortion services, because you have like, we all know that USAID is one of the large donors for the health system, especially in DRC, for example. So you have in the same health system, you have some providers providing abortion services and family planning and others, and some others that can't provide because their services are supported by USAID fund and things like that. So which really increase the stigma and do not allow women to have access to the information and to the services. And the impact is on the women who are living in the low income region, but also on the young girls. So that's what I can share for this stuff. Thank you.
Thank you. Both of you mentioned exactly what our fear was that this would be emboldening anti-rights and anti-choice movements around the world. So thank you for sharing that experience and that information with us. I'll also turn it over to Sarah. Sarah, obviously UNFPA does work around the world. So I'd love to hear what you've been hearing about the Dobbs ruling and how that's impacted the countries where UNFPA does work.
Thank you so much, Samira. And I want to say thank you to ICRW for having this important conversation today. And I just have to say it's so important to have Nelly and Dr. Mulunda's perspective here. I really am very empowered to hear what you have to say. So I want to say as context, I'm speaking from Honolulu where the sun is rising right now. So hopefully the sun will shine by the time I'm done speaking. Samira, just going to take a step back in terms of with regard to UNFPA. We are a multilateral organization that works in Kenya, works in the DRC, works around the world. We don't work in the United States, but we certainly have the United States as a key partner to us to fund our work and engage with us on a technical and political level. So it's really fantastic to have Jamille on this call today for that leadership and that partnership. Right before the Dobbs decision came out, UNFPA issued a report called Seeing the Unseen. And I highlight that because of what Dr. Mulunda said about the stigma. And that report really focused on the issue of unintended pregnancy, which no one really talks about, that half of all pregnancies, which is 121 million per year, are unintended. And that doesn't mean necessarily they are unwanted. It just means that they are not planned. And of those, 60% of those unintended pregnancies, more than 3 or 5 end in abortion, which is often unsafe, and really highlight what the situation is being highlighted today in Kenya and the DRC, that women are dying from unsafe abortion. And when our report came out just at the moment that suddenly the world focused on access issues in the United States as well. So in one way I want to say, I recognize the complete challenge that this decision raises, but it also raises a moment to lift up and highlight how these issues are and the impact that lack of access to SRHR has for women in the world and how deadly it can be. In terms of the work UNFPA does, we are based in the program of action from the 1994 Cairo conference, which 179 countries agreed to, which say that unsafe abortion is deadly and must be addressed. And also the United Nations works within the SDG framework, specifically SDG 3, focused on maternal health, which all UN member states have committed to. So this moment in time, I think, is an incredible opportunity to build on political will that we have to do to work at all country levels to make sure that women have pregnancy as an aspiration, not an inevitability, and that women are able to access services that they need and can trust. I'm happy to continue this conversation. Over.
Thank you so much, Sarah. Really appreciate all of your responses. We're going to go to our next question. So we know that there are policy restrictions on funding for abortion, such as the Helms Amendment and the global gag rule, which is not in effect under the Biden-Harris administration. So what would you like to see done to expand access to SRHR, and what can the Biden-Harris administration do, and what can Congress do to expand and protect SRHR? And, this was something I think, Jamille, you mentioned in the first question regarding the policy restrictions. So if you would be able to elaborate a bit on what the Helms Amendment, does, and what restrictions currently are in place, and whether USAID funding would be able to be used, despite the Helms Amendment in cases of rape, incest, or life endangerment. That'd be appreciated.
Thank you. The longstanding statutory restrictions related to abortion that are in place, these apply to U.S. foreign assistance funds. So they prohibit the use of U.S. foreign assistance funds to pay for the performance of abortion as a method of family planning, to motivate or coerce persons to practice abortion, or to lobby for or against abortion. These restrictions do not prohibit the provision, consistent with local law, of information or counseling about all pregnancy options. Funds may also be used for the provision of post-abortion care and emergency contraception. So for over 4 decades, the United States has worked to ensure compliance with these abortion-related restrictions on foreign assistance while maintaining our leadership and commitment to global health. We are the largest bilateral donor to global family planning assistance, and are committed to high-quality, client-centered sexual reproductive health and rights services. So we are continuing our broad investment in sexual reproductive health and rights while ensuring compliance with the abortion-related restrictions that I have outlined. Thank you.
Thank you so much. That's really helpful. So I'll turn it over to Nelly, if you don't mind just sharing, how has the Helms Amendment and previously the global gag rule, how has that impacted the work that you all are doing in Kenya?
So when we think about some of these policies that are made back in the US, Kenya borrows a lot. And when we look at our constitution, Kenya is a country that had borrowed a lot from the US. So some of these pronunciations, some of these policies have long-term effects to the kind of work that we do. And while there will be support for example, for access to contraceptives, we have, like I mentioned, a very boldened movement of opposition. And they fight contraceptives, they fight abortion, they fight LGBT care, they fight everything reproductive rights, or they fight reproductive justice. So we cannot support one component of reproductive health and leave the other components, because when opposition fights, they fight all the components. So that means that the issue of teen pregnancies, we will continue seeing them, whether we have funding for contraceptive, whether we have access to contraceptives or not, because the way opposition operates is they instill fear in both the healthcare providers and the women and girls that are in need of these services. So we need support for countries that are working around reproductive rights. So for us, we have seen opposition bold, stronger, infiltrate policy-making spaces. And this is because, like I mentioned, they have non-restricted funds. The kind of funding that we get as civil society organizations are activity-based. funds that are specific to the whatever activity the donor wants us to implement. The opposition we have restricted funding. The opposition has non-restricted funds. Sorry about that. So that means that they're able to use their funding for their advocacy, for the work that they want to do. So that limits us even engaging with the policymakers. We also are seeing it hurting the strides that we've made towards expanding sexual and reproductive health. I think Kenya has been among the countries that has made a lot of strides when it comes to safeguarding reproductive rights in this country. Recently, we had the huge Malindi win where we had an adolescent and a provider that had been arrested and arraigned in court for accessing safe abortion services and providing access to safe abortion services. And the provider and the young girl were released because our law allows access to safe abortion services when the health or the life of the mother is in danger, and this is determined by our healthcare providers. So in terms of the work that we have done, we've done a lot of advocacy, made a lot of strides, and that means that it's going to hurt the strides that we've made initially. Then, of course, we will start seeing COVID happened, and during COVID, of course, reproductive health was neglected in a way. It was not prioritized, and we saw a lot of unsafe abortion coming up. So with such decisions being made, it also continues to create an enabling environment for not an enabling environment per se, but allows opposition to thrive and instill fear and create stigma for access to safe abortion services, and also hurting the other components, like I mentioned, contraceptives, HIV and AIDS, and also cancer, etc. Then, of course, I believe that given the standing of the US in terms of focusing on probably contraceptives, it's going to hurt the other components of SRH services, because then we're going to see a repeat in limited funding, restrictive funding, especially for organizations that provide safe abortion services, not being able to access the other streams of funding for contraceptives, for HIV, etc. Then finally, we are going to see our providers harassed and arrested more, because there will be reference to the decisions that have been made back in the US and just saying, you know what, this is illegal and we cannot do this. Samira, thanks.
Thank you so much. Dr. Mulunda, I'm going to turn it over to you.
Thank you so much. Thank you, Nelly. Really appreciate your point. And I wanted just to add, I think at this point, I do not have really something to add on what my colleague said, but I have some questions that, just to allow us to understand what's happened. I was like saying that USAID is one of the large donors, for example, in my country. And I'm so happy that we have Jamille here. And one of important question is about what is allowed and what is not allowed. When we talk with the global level, things seem simple, like what is allowed, what is not allowed. But on the ground, this is not what's happened. Do USAID Global have a way to assess what is happening on the ground? Do USAID have can found, for example, access to the abortion in the case of rape? Because this is allowed in DRC, for example. In the case of rape, the abortion due to the rape, the pregnancy due to the rape, women can receive services. It's allowed in the country. It's official. Do USAID provide those kind of services? When it came to providing information and counseling, yes, this is what is no, but on the ground it's not, because even in the training, those sub-grantees that works with USAID are not trained on abortion information, counseling, referral pathway, and things like that. There is no connection between those who are working on the abortion and those who are funded by USAID. How can they refer women to to other providers that they even don't have these kind of connections? So all those questions are due to the fact that it's not clear on what is allowed and what is not allowed. And I feel like we put more emphasis on what is not allowed than on what is allowed. And what is not allowed serve for those who like made those laws, right? What is allowed focus on women. So if we focus on what is allowed, we explain it really well, put like make available funding for like provider to be trained to make even the first counseling. In DRC, for example, safe abortion, abortion safe use is available. Women can get medication from the pharmacies. So if they receive counseling from a clinic supported by USAID, this can allow them to have access to the safe services, and we can reduce for 30% the mortality in the country. So I think, yes, of course, as we talk about climate, because it's, you know, we just coming from COP, is that we need more action. And that's really important. And that's like my point on this is to say, yes, of course, there's like what is allowed, what is not allowed, but how we support women in this context. I think that would be really helpful for the women and girls on the ground. Thank you.
Absolutely. Thank you so much. And I think you just touched on a very important point, that this decision has obviously exacerbated concerns and has definitely caused more confusion and uncertainty. And in the policy brief that we are publishing today, we have several recommendations that we've outlined for the administration, for Congress, and for diplomats internationally. So would really love to have folks' thoughts on that in another time on what our recommendations are. But I'm going to turn it over to Sarah now, just to hear her thoughts on policy restrictions and how that has impacted UNFPA's work and what you'd like to see done to expand access to SRHR.
Well, thank you so much, Samira. This is a huge challenge. For us at UNFPA, we have, unfortunately, an up and down relationship with the US. And depending on who might be in power, we're either allied or we're not. And so as a result, it's sort of like we have to start at ground zero and begin again. And some of that, I think, really reflects what you're saying, Dr. Mulunda, in terms of the almost reconnection, the repartnership, the re-engagement is a big process. And in that process, we lose ground in terms of programs that were funded that suddenly lose the funding, and then new partners are chosen, and it gets very difficult. So that consistency is something we all strive for. I want to say in a huge moment forward. Last week, we at UNFPA had our first ever deep partnership consultation with many parts of the US government. Jamille was a key leader in that. And that aim of that conversation was to try to bring some of that clarity. Some of the work we are doing is to try to bring more connectivity ourselves with USAID missions and on the ground level. So I think we see that, and we recognize some of the lack of, I like what you said about knowing what we can do as opposed to what we can't do, because we're all under impression often of what we can't do holds us back in terms of what the kind of work or services or advocacy that we want to do. So I think that's extremely important. And I think the other thing which is so important about this conversation, and Samira, in terms of your policy brief that you're issuing, that ICRW is issuing today, I think it's extremely important when Nelly raises about local organizations having the ability to have unrestricted funding and being able to do the work that they need to do. No USAID or UN agency, multilateral agency, is going to be effective if we don't have strong civil society partnership and engagement, because that's where the work and the change happens. And so that's really key to have those voices. And then also to try to get these stories and voices to US policymakers. One thing that I have seen over and over is that sometimes the story of one that can make a difference, or if a member of Congress can go to the field and see things, that changes decisions as well. It's a lot of work on that part, but that's a key role that ICRW and other organizations in the US can play to try to bridge and bring forward those stories and experiences. So look forward to this continued conversation.
Thanks so much, Sarah. I'm going to move on to our next question, just for the interest of time. So what potential ripple effects do you see the Dobbs decision having? And can you speak to what chilling effects the decision has or may have? As you all may know, a May 2022 GAO report on the global gag rule found that many organizations felt a chilling effect under the prior administration, and thus services were reduced. Do you anticipate that type of thing happening again? And like to start by going to Nelly. Thank you.
Thank you so much. And I'll probably just also talk about what Sarah said. It's very important for the international organizations to bring forth voices of people that are affected by some of these policies, to tell their stories, because we will have lives lost. We will have unsafe abortion cases. We will meet fetuses by the riverbanks. We will have girls commit suicide because they do not have information of where they can access these services, or because of the stigma that comes with lack of information. So really, you know, telling these stories and not having a second or a third party telling a story, for example, of a beneficiary or a rights holder from a village in Kenya. Having that girl, giving that girl a platform to tell her story on the effect, the impact, the chilling effect of some of these policies that are made at the global level. And back to the question, of course, then we'll start seeing these cases, we'll start seeing reported, of course, not documented because it's very soon, but just reported cases on mainstream media, print media, of girls that have committed suicide as a result of abortion, girls that have died because of attempting of having botched abortions. We will have cases, like I mentioned before, our providers being arrested because of the environment that there is. Organizations such as ourselves that provide abortion might end up again going back to the cycle of not accessing funding for reason of us talking about referring or providing services related to abortion. And what this means then, that one component of abortion that is not funded affects all the other components of SRH, as I said before. And who are the people that suffer the most? Are the people that are not able to affect $1 a day, the people that even have no clue of these policies that are made, and they don't even understand what is going on, but their lives are put in danger. They have to die, or they have to lose their uterus. We've had stories of girls who've lost their uterus because they could not access services from a qualified healthcare providers. And again, we will just see, you know, we are not able to access the commodities. We are in the process of talking about self-care, but these commodities are not going to be available, even as we say that the women and girls can, you know, make the choice. They have the knowledge to manage their abortions at the comfort of their homes, but they cannot access these services because no healthcare provider is willing to provide these services or provide even the abortion pills.
Absolutely, which is truly really terrifying and just devastating to hear. Appreciate you sharing that. Dr. Mulunda, I'll turn it to you.
Thank you so much. Yeah, I wanted just to add on what Nelly said, that I think the context is totally different, and the consequences also. When like a woman who is living in US do not have access to abortion, it's not the same situation than the one who is living in Goma, in the humanitarian setting, where there is a war, where people are displaced and things like that, where there are many cases reported of rape. So the consequences are totally different on the life of women. I think it's important to, like, you know, recognize the fact that taking some decision without thinking about what's the consequences on the ground, what will happen with women and girls. Some of them they do not have a level of education that allowed them to have access to the information. They don't have access to electricity. They don't have access to the internet. They don't have any source of information. Most of them are reliable on the health system. The health system, which is largely funded by USAID and US government, where information and counseling are not clearly provided for women. And that's a big problem that we really need to focus on as a feminist movement organization to work together and make our voice heard by the US government, because they can change this, not only for the US women. Ipas is working mainly outside of the US, but now we are looking at how we use our experience of working in Latin America, in Africa, in Asia, to now bring this experience to the US, because US is going back. Thank you.
Thank you. Sarah, I'm gonna turn it over to you. I'd love to hear from folks, you work with on the ground around the world, if they have shared anything regarding feeling a chilling effect because of the Dobbs decision, or do you anticipate this potentially happening again?
Yeah, thank you so much, Samira. I mean, these are definitely always, it's so important to hear these stories from the field, and of course echoed in other parts of the world in terms of confusion, lack of clarity, concern. I do want to say it's, hearkening back to Jamila's earlier remarks, and maybe I'm going to jump ahead to a question in the chat, is that the US has been quite a good leader in this, and we actually are receiving our largest contribution in funding ever by a mile. And so I think sometimes we recognize this larger issue that's happening domestically in the US, but we're not countering at the same moment that we have a US government that is leading both in terms of funding commitments and policy, and the important voice that they can have. So I think that's one of the storytelling challenges that I know Jamila and her colleagues are doing at every forum, is to show that commitment, to be at conversations like this. And I think I really hear on these on the ground experiences, what we are doing is encouraging, or actually not even encouraging, we're building those opening and opportunities for our colleagues on the ground to be talking to USAID colleagues at the field level. And so we also need to make that space for civil society to be part of those conversations too. But I think it's, I absolutely hear the worry and the concern and the stigma, all of these things, but we do have a US government that is very open, receptive, and leading on those concerns.
Thank you, Sarah. I'm going to move on to our next question. As we know, the US had midterm elections this past Tuesday, and we're still waiting on results. But what do potentially changing dynamics in Congress mean for global SRHR? I'd like to turn it over to Nelly.
Again, I mean, this just having listened and followed a bit is, I had a lot of religious narrative, a lot of protecting religion. And these are some of the concepts the opposition back in Kenya and in Africa are borrowing. And I think across the globe, they're using the religious narrative to fight reproductive justice. So definitely, again, this will give the opposition more muscles. They will make them more bolder, more vocal, and just use the religion to try and fight access to sexual and reproductive health information and services. And Kenya as a country is a religious country. We also just came from elections the other day, and the kind of leadership we have is very religious. So having so many religious folks in the US or in, being elected in the midterm elections will definitely make the leadership that we have very bold. And that means that it is going to be a struggle for us as a movement to fight for sexual and reproductive health. And this will need a lot of investment so that we are doing a lot of research, a lot of capacity building, a lot of advocacy to ensure that we are not losing out on the efforts on the strides that we've made.
Thank you. And Dr. Mulunda, I'll turn it over to you as well.
Thank you so much. I think the question related to women's rights and the right for sexual reproductive health and right, which include the right for the abortion, should not be like linked to who is in power. It might be clear that we have the law that are sustainable, that support women, that allow women to make their choice clearly. Now, actually, I know that from like the work that we're doing with our team and some other partners in Washington and Iran, we have some support, in the Senate and in the government, those who are really open to support abortion movement and allowed access to abortion everywhere. We'll continue, advocating, working with them. We don't care about what's happened with the elections because the women's rights and the right for abortion is not linked to that. Yes, of course, can be at some point impact on that, but let's continue advocating and, like working with those who are open to support to continue the movement and allowed access to safe abortion. There's also some responsibility for the administration, to act and continue showing their support to women's rights and to the right to the abortion in the America, but also outside. Thank you.
Thank you so much. Yes, absolutely. Abortion is healthcare and it should not be left up to politicians. I think that's a very important point that you laid out. So thank you so much. Sarah, I think I saw your hand raised. I'll turn it to you.
Thank you so much. I just want to, speaking more from my personal perspective as an American, and I just want to say earlier on what Dr. Mulunda said about stigma. The election results are still coming in, and we're not here to talk about domestic politics in the U.S., but I do think that we can see that there were a lot of good wins for reproductive rights in terms of different outcomes, and that this shows that this is a winning issue and that this is something that we need to lift up. And so back on the issue of stigma, I think there was a lot of good news that came out of the US. If we start to see some of the, in particular, if you look in Kentucky, where they voted down an attempt to ban abortion as part of their constitution. So I think that as the results come out, people will start to see not just that reproductive rights is a good political issue, but back that we just also need to talk about this and destigmatize that women in our lives, our mothers, our daughters, our sisters, our neighbor across the street, many people in our lives have had abortions and they hold this in shame or put stigma around it, or as Nelly is talking about, the religious condemnation. And we need to push back about that and open up and tell these stories and make it that it's not something that is shameful, but it is part of everyone's everyday experience and that people need the services and care. Over.
Absolutely. And thank you so much for pointing that out, especially for our global audience who may be joining us today. There were some significant wins in the SRHR space during these elections. So that is absolutely correct. And thank you for sharing that. I'm going to move on to our next question and make sure we have time for Q&A. But what has the Biden administration committed to doing to protect global SRHR? I know that there have been multiple statements that have been made by Secretary of State, by Ambassador Power. And if you don't mind, Jamila, if you could just elaborate a little bit on that, that would be very helpful for our audience. Thank you.
Thank you so much. Appreciate the opportunity. It is critical that we have conversations like these, and important to hear from our partners about what the priorities, what the experiences are for women and girls that are seeking healthcare in their communities and countries. And the Biden-Harris administration is committed to continuing to be leaders in advancing and protecting sexual reproductive health and rights at home and abroad. We see it as essential to achieving goals of health equity and of gender equity and equality. So we see it as a central priority for the administration. So we have committed to continuing to demonstrate leadership in foreign assistance for global health, for gender equality and women's and girls empowerment, and responding to humanitarian crises, including addressing gender-based violence and health access, including sexual reproductive health and rights access during humanitarian crises. We will continue longstanding support for evidence-based policies that advance public health, respect and promote human rights, put gender equality at the forefront of our foreign policy engagement. We are very proud to remain the largest bilateral donor to global family planning assistance that has spanned more than 5 decades, and it is combined with a commitment to investing in high-quality, client-centered sexual reproductive health services, where we are seeking in these investments to improve women's well-being, to promote gender equality, and ensure women's control over their bodies and futures. We at USAID are also very committed to localization, to across all of our assistance be providing more resources to local organizations, and to be lifting up and ensuring that our policies and programs are informed by local voices, and that they're at the decision-making table with us. And so that includes commitments around support for local organizations led by women and girls, local LGBTQI+ organizations, and supporting the leadership of local women and girl and LGBTQI+ individuals in across all the issues that affect their lives, including their access to healthcare and their experience of sexual reproductive health and rights. So those are commitments that are driving, informing the both resource commitments that we've made to scale up our support to family planning assistance, as well as to more broadly to gender equality and women's empowerment. We have made a commitment next year in our next fiscal year to double our gender work across USAID and the State Department. And this includes integrating more attention and more investment in women's access to healthcare, women's health, supporting women's health outcomes and girls' outcomes, including in the SRHR space. Sarah spoke to our partnership with UNFPA, and we very much celebrate the opportunity to deepen the dialogue that we have with UNFPA and to increase the resources that we are providing to them to support their global leadership on this issue. And that is combined with as well the support to local organizations and local leaders and voices that I spoke of already. So we are truly scaling up and strengthening our partnerships with leading voices and peers in the family planning community, SRHR community, from UNFPA down to local leaders and local organizations led by women, girls, and LGBTQI+ individuals around the world.
Thank you so much, Jamila. That is also so fantastic to hear about the commitments from this administration for next year in terms of the funding for these programs. We hope that the FY23 omnibus has robust numbers for family planning and gender equality programs. So that is just fantastic to hear. I will just turn it over to Sarah as well, just to get your thoughts on what you would like to see done to protect global SRHR. And if you'd like to elaborate a little bit more on that partnership between UNFPA and the administration.
Thank you so much, Samira. I'll try to do it quickly because I see there's so many questions in the queue, but I just want to say, in addition to, as I said, the robust funding that we have received from the US government, we are also working both in country as well as here through many technical partnerships to expand and develop the ways that we engage to ensure access to SRHR. And so we have 3 overarching goals in terms of addressing unmet need for family planning, addressing GBV prevention, and of course, ending maternal mortality. And that's where access to safe abortion and the issue of unsafe abortion comes in our greatest focus. So we, as I say, are partnering in multiple ways. We also really appreciate and value the many champions we have in the US Congress who lift up these issues and also prioritize both funding and hopefully policy changes that will make this work easier. But it's a tough road, as we all know. So I'm happy that the sun keeps rising, because I do want to provide some hope and say that we can use challenging moments to also raise attention. And I do think I want to keep emphasizing that this is an opportunity to bring more attention and to really push for that political will, because I think ultimately the issues are lack of political will and really at its core, a lack of gender equality. And so when women are not seen as equal partners, when women do not have equal access to all aspects of life, it just triples down in reflecting on their not ability to make decisions about their bodily autonomy and their own lives. So what we can do collectively, civil society with US government and other member states, to lift up the SDGs and commitments made in international agreements is going to be the best we can do for accessing SRHR. Over.
Thanks so much. So we're going to just turn it over to answer one of these wonderful questions we received from the audience. Thank you all so much for putting your questions in the Q&A. Unfortunately, we're not going to be able to get to most of them, but we hope that we'll be able to continue this dialogue in the future. So one particular question that we received was in regards to how can we address the stigma in certain parts of the world. This particular question was in reference to West Africa, where abortion may be viewed in a particular light. So I think, how can we take a look at that and discuss that? So if we could go to Dr. Mulunda.
Thank you so much for the question. I think the question related to stigma is really important, because even when law change, even when you have guidelines within the health system, stigma is still preventing access to safe abortion in many countries, especially in DRC, where you have a big religious movement which have kind of influence on the government and all the life in the country. So I think we know what to do, but we're not doing it. And all the time that there is any important partner that is not clear on abortion access, that will absolutely increase the stigma in the community, in the health system. So we absolutely need, and this was my request, is to see how, for example, USAID, because we talk about the US government, how they can help to clarify on the ground. I'm not talking about what they decide on the US, but on the ground, how they can help to clarify what is allowed and how their sub-grantees can, support the movement, even if they're not providing abortion services, but not communicating against abortion services, not training provided against abortion services. That would be really helpful, not like discussing with the government, because when they discuss with the Minister of Health, for example, and they tell them that how a support can't be used for the abortion, they say, okay, so abortion is not something good, but that's not important for women. So, but we have some other patterns that are on that. I think that's the first thing that we can work on that. And this would allow, because the other things related to the religious movement from the communities and things like that, those are with value clarification and some other communication on the ground, that can help for that. But the institutional stigma, which really influence on the ground, is that we need to address as soon as possible. And the administration in the US can do that, and USAID can support to get this as soon as possible clear in the mind of those who are implementing their project on the ground. Thank you.
Thank you. Nelly, I'll just turn it quickly over to you as well.
Yeah, so probably I'll just talk about what we are doing to address stigma back in Kenya. Number one, we are we have what we are calling an intersectoral movement, which is working towards addressing issues around abortion and having an ecosystem of advocates for access to safe abortion services. This includes, of course, people from academia, research, healthcare providers, young people, law enforcers, the judiciary, etc. Then at the grassroots level, given that our work is also really at the grassroots level, we are having dialogues. And the dialogues we are having with opinion leaders, the religious leaders, young people, again, healthcare providers, as experts in the communities, to demystify myths and misconceptions around abortion, and also sensitize the community on the legal framework when it comes to SRHR and also abortion. We are working with what we are calling intergenerational spokespeople that are also our champions when it comes to issues around abortion at different levels. And also young people are very key in our programming, because a lot of data that we get for those that are in need of abortion services, the unsafe abortion cases, are young people. Currently, Kenya is number 3 in leading in HIV reinfections. We have issues of teen pregnancy, and we are working through we are working on the 3 zeros that our government committed to during ICPD, and we are using just different strategies to ensure that there's public-private partnership and working very closely with the government to ensure that we are dealing with stigma, because when we're talking about stigma on abortion, we still have stigma around contraceptives. So we are working together and ensuring that we have we are incorporating all the components of SRH as we address stigma related to it. Thanks.
Absolutely. Thank you so much. And just a quick preview of one of our recommendations in the brief, which Dr. Mulunda, you kind of referred to that, but one of ICRW's recommendations is for the administration to provide clear guidance to countries implementing partners and organizations that receive U.S. foreign assistance about what is permissible and what's not. I encourage everybody on this call to take a look at our brief when it is available on our website later today, and especially take a look at our recommendations. We'd love to hear your thoughts. But as we just wrap up now, I'd love to hear everyone's quick final thoughts and look ahead. So maybe just 30 seconds each, and we can wrap it up from there. So I'll turn it over to Sarah.
Well, I just want to say thank you so much, Samira and ICRW. And I think my final thoughts were, we need to hear from Nelly, we need to hear from Dr. Mulunda, and we need to hear from their colleagues on the reality, and we need to partner together to do the best that we can to lift up SRHR and lead, take our work from your lead in terms of what the experience is at the country level. So thank you for this great conversation this morning, and I look forward to continued collaboration.
Thank you. I'll turn it to Nelly.
Thank you so much to ICRW and just sharing a platform with amazing spokespeople from USAID, UNFPA. We work very closely with UNFPA Kenya and my colleague from DRC. What I would say as we think about better health outcomes, let us think about prioritizing sexual and reproductive health because they contribute to the outcomes. Thank you so much.
Thank you, Nelly. Dr. Mulunda.
Thank you, everyone. Thank you for this opportunity. What I can say is that we still have the chance to change life around the globe. And as I said in my country, we can reduce inequality by promoting women's rights, which include the access to safe abortion. And we need all the donors. We need all the government to support this and to respond to the call coming from the WHO to share clear guidelines on how women can access to the information and high quality of abortion services. Thank you.
Thank you so much. And Jamila.
Thank you so much. First, it is incredibly valuable to have conversations like these where we have the opportunity to hear from organizations, leaders around the world, like Nelly and like Jean-Claude, to hear about what your experiences are in your communities. So thank you for sharing that. For USAID, we will continue to prioritize sexual and reproductive health and rights. We will continue to prioritize women's and girls' access to contraception. We recognize that that is even more important now than ever, and this includes access to post-abortion care, access to emergency contraception, and we will ensure that as we continue our investments in family planning, in sexual reproductive health and rights, that we will put women and girls front and center and hear from them what their needs are and what the opportunities are to support them and to respond to those priorities. Again, recognizing that women's access to healthcare is critical to their own lives, to the health of their communities, and is critical to achieving the gender equity and equality goals that we share and that we are advancing around the world.
Thank you all so much. I just want to thank all of our speakers for joining us today and for this riveting discussion. Sarah, Jamila, Jean-Claude, and Nelly, thank you all so much for sharing your expertise with us. And thank you all to you all in the audience for taking time out of your day to listen to this discussion and to ask such important questions. Sorry we couldn't get to them all, but really appreciate your engagement. And to read our policy brief as mentioned, please see our website, icrw.org. We will also be sending it out with our recording of this event, and also hope to have more engagements and dialogues like this in the future. So thank you all so much for participating, and we hope you have a great rest of your day. Take care. Bye.
Thank you.